Meclizine is an antihistamine medication that is commonly used to prevent and treat symptoms such as nausea, vomiting, and dizziness caused by motion sickness. It can also be helpful in reducing dizziness and loss of balance, vertigo, related to inner ear problems. The usual dosage for adults is 1 or 2 tablets taken once a day, while for children it is best to follow the doctor's instructions. It is recommended to take Meclizine with a full glass of water, and it can be taken with or without food. For the best results, it is advisable to take this medication before the symptoms of motion sickness start. Make sure to follow all the directions on the product package or as prescribed by your doctor. Take Bonine by mouth with or without food. If you're taking the chewable tablets, make sure to chew them thoroughly before swallowing. The dosage of Bonine will depend on your medical condition and how you respond to the treatment. It's important not to increase your dose or take it more often than directed. If you're using Bonine to prevent motion sickness, it's recommended to take the first dose 1 hour before starting the activity, such as travel. Remember to consult your doctor if your condition doesn't improve or if it gets worse. If you experience drowsiness, dry mouth, or tiredness, it's important to let your doctor or pharmacist know. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. If your doctor has prescribed Bonine for you, it's because they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor if you experience any mental or mood changes, fast or irregular heartbeat, shaking, or difficulty urinating. In rare cases, a serious allergic reaction can occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before taking Bonine, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to discuss your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, seizures, stomach or intestine issues, an overactive thyroid, difficulty urinating, liver problems, or kidney problems. Bonine may cause drowsiness, and using alcohol or marijuana can make this effect more pronounced. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. It's also important to avoid alcoholic beverages and talk to your doctor if you're using marijuana. If you're planning to have surgery, be sure to inform your doctor or dentist about all the products you're using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of Bonine, and it can sometimes cause excitement in young children instead of drowsiness. Older adults may also be more sensitive to the side effects, especially drowsiness, confusion, or trouble urinating, which can increase the risk of falling. If you're pregnant, Bonine should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's unclear whether this drug passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking Bonine, it's important to be aware of potential drug interactions. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Some products that may interact with Bonine include antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It's also important to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, be sure to ask your pharmacist about using those products safely. Lastly, it's important to be aware that Bonine may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you are taking this medication. If someone has taken too much Bonine and is experiencing severe symptoms like passing out or trouble breathing, it's important to call for medical help right away. In the US, you can call your local poison control center at 1-800-222-1222. For Canadian residents, contact your provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, and widened pupils. In children, mental and mood changes like restlessness, irritability, and hallucinations may occur before drowsiness sets in. Make sure to keep all of your medical and lab appointments. It's important to stay on top of your health and follow up with your healthcare provider as needed. This will ensure that you are getting the most benefit from your medication and that any potential issues can be addressed promptly. If you forget to take a dose of Bonine, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Bonine, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. And when it comes to getting rid of Bonine, it's best to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.